there was a lot of knowledge required about insurance, which as a dentist, we're not taught that. We don't know anything about that. From what little I was learning, I realized that things were still not being done properly. My over 90-day AR would, within a matter of weeks, be exponential. My name is Anisha Ranchhod. I'm a board certified pediatric dentist. I have a practice in beautiful Lodi, California. So I bought my practice from an existing dentist in 2017. When I bought his practice, he had one person up at the front and an office manager doing pretty much everything, and two assistants in the back. He was only contracted with one insurance, and it was a small practice. It had about 800 patients when I bought it. Worked with the existing staff the way it was, as it normally goes when a new dentist takes over an existing practice. The staff has gotten used to a slower pace because the dentist's been there 30 years, he's slowing down, and then this new doctor comes in and wants to grow the practice and change things. Slowly the staff were like, I'm gonna retire, I'm dropping off. I retained just a couple of the existing staff who are still with me, who are continuing to grow with me. But the biggest challenge I had was finding somebody who was good at billing. As I grew the practice, I added more insurance plans. There was a lot of knowledge required about insurance, which as a dentist, we're not taught. We don't know anything about that. From what little I was learning, I realized that things were still not being done properly. My over 90-day AR would, within a matter of weeks, be exponential. I had a couple of billing specialists in the office. One billing specialist didn't have any kind of system. I would find insurance paperwork here, there, and everywhere with like notes scribbled on them and no follow-up. And it was just very frustrating. I met Swiss Monkey. I saw them at our dental society events, and finally I reached out. It has taken a huge weight off my shoulders. I am not looking at insurance claims. I am not trying to post a check. Things that I was never good at, but I tried to learn because I was like, I can't rely on the people who are in my office to do a lot of this for me. Having a billing specialist through Swiss Monkey has made my life easier. That person has someone overseeing their work. I'm not having to do it myself on a day-to-day basis, and that person is in touch with me to let me know if there are any issues. Now, if I ever have a question, I just give her a call. She's able to immediately answer any questions that we have about an insurance. I have one front desk person in my office who works great with my billing specialist who's remote, and together they tag team those funny insurances that need a little extra follow-up. It rarely goes above 10,000, which is amazing for a practice. I mean, it's not blowing up on us at all. We try to keep it even lower than that because now we're able to with that remote person. I also use Swiss Monkey to my new dentist credentialed with all the same insurances that I am credentialed with, because that wasn't busy work that I can do while I'm seeing patients. It's impossible. I also use them to hire staff, and they would pre-vet potential hires, set up interviews, and then I just had to talk to them. Whereas when I did it myself and I used Indeed, I'd get about 200 applications that I'd have to sift through. I'd set up a whole day of interviews and maybe one person would actually show up. They had different teams for everything. There was a different team for the hiring. There was a different team for the credentialing. And then our billing specialist, she's amazing. She's local to the area too, so she's popped in a few times. We're set up on Ring Central to communicate with her throughout the day. We have her private number if we need to call her and specifically ask her anything. She's set up on a remote system and I'm able to see her online doing her thing while I'm in my office. She's amazing. She knows, she's very knowledgeable. She's been in the industry for a long time. Nobody in my office has that kind of knowledge. And to date, nobody that I have hired for that position has that kind of knowledge. I look over and I can see, oh, she's working on so-and-so's claim. Great, because we've been waiting for that one. Or if I have a question, I can just directly contact her. My front desk staff also has another platform that they're using to communicate with Swiss Monkey, where they're kind of able to highlight and redline things that need follow-up. It's been working great. There were no real bumps in the road. It was pretty seamless. They already had platforms in place to help us set things up in a way that communication was easy. The most value is I'm not working harder, I'm working smarter. I'm also not stressed out, which is huge. I mean, I have kids, I have an associate that I'm pulling up on. The last thing I want to do is look at an insurance claim that I don't understand or an EOB and try to figure out why it wasn't paid. Like, that's not something that I am good at, and that's not something that I want to do. Just speaking as a business owner, I'm pulled in a million directions. I'm involved in the dental society. I'm involved in the kids' school. They're both on travel teams. There is no time outside of my 8 to 5 to work on my dental stuff. And during my 8 to 5, I'm most useful seeing patients, not doing other stuff. And so having this service allows me to do that. We have close to 4,000 patients in the practice now. And our over 90-day, at the end of last year, it was about 8,000. The year prior to that, it was 5,000. There was only 5,000 in outstanding payments. A practice of 2 doctors that's open 5 days a week. I mean, that says a lot. The other thing is patients don't get mad. Like, the biggest thing patients get mad about and will throw a bad review out for you is if they don't understand the financial part of it. Having someone as knowledgeable as Debbie has helped in some ways train my office staff to be able to answer some of those challenging questions. They're not having to look it up on the internet. They're not having to, call Dentrix and try to figure it out. They call Debbie and say, can you explain to me why the patient estimate said this, but this is actually what they owed, or vice versa. They're able to explain it to them within 24 hours of a phone call. And, we're able to do that in a timely manner. In the past, we had our office manager taking care of that, but it was a very strict policy that on Monday and Tuesday, you could not talk to the office manager because she was just billing. And that was difficult for the office. So we don't have anything like that anymore. Our billing is getting done. It's not all getting stacked up for a certain day. I am posting checks every Friday. I'm not waiting sometimes 2 weeks or 3 weeks to post my checks. It's not affecting our cash flow. It's just seamless. It happens and I'm not even aware it's happening. I'm seeing patients and doing what I do best. You as the dentist should be doing dentistry. You shouldn't be focused or things taking away from your patient care experience. Having a virtual billing person takes that load off. One of the other benefits, it's one less employee in your office. It's one less workers' comp insurance payment. It's one less physical body in the office. If you're a small practice owner, you don't have people tripping over each other. And it just takes a weight off your shoulders in this environment where it's hard to hire people. It is hard to find staff. Having a team already set up with experienced people who know how to do what your office needs just takes that weight off of you. Even hiring and firing is stressful, and that's taken off your shoulders. Anytime anyone complains about anything in their practice, I'm like, why don't you try Swiss Monkey? They offer these services, and why don't you give them a call? Everything is going to have a financial impact. You have to balance what is the financial impact, what is the stress burden, and how can you best have balance in your practice. And when you weigh all that up, it's a no-brainer.